we're going to go
Uh,
ahead and get started. So, hello everyone. My name is Davina. I'm sure you've all gotten emails from me or heard from me on Slack. I'm the founder and chief executive officer here. If we didn't already get to meet at orientation, I'm very excited to be hosting all of you again for our sixth annual summer program. And now we'll go ahead and introduce Ahmad. So, Ahmad, if you want to give everyone a wave or feel free to
yeah.
introduce yourself, go for it.
Good morning, everyone. I believe everyone met me on Friday during orientation. I'm so excited to meet everyone. I'm Ahmad. I am the executive director here at M.D.s Power, and I'm so excited to kick off year 6 with you all. Really excited to be here.
Yeah, and for those of you that don't know, Ahmad is actually the reason we have an international program here. It was his creation of it, and so we're very happy to have him with us. Also, just a brief reminder for anyone that wasn't able to see my message on Slack. So, our guest speaker today will be joining for the second half of the session, and we're going to be teaching our workshop first. So, just for today's session, the workshop will be first, and our guest speaker shadowing will be at the end of the session. We'll send out attendance forms throughout the session, but no worries for right now. Just sit tight, get ready to learn from our workshop, and if there's anything you need to know, we'll make sure that you know it. We're not providing any live translation today. We will be providing translation services after the session is done, but just a quick reminder that we don't provide any live translation services. So with that, I'll go ahead and hand it over to Rourke, who'll be teaching our emergency medicine and CPR workshop today. If you'd like to take notes during the session, you're more than welcome to, but I'll go ahead and hand it over to him.
Good morning, evening, afternoon, wherever you are in the world. Um, I hope you guys are all having a fantastic day, and I'm really excited to start our sixth summer program off in a fantastic way. So I'm gonna try and keep the chat open. It is a little hard for me to see while we are doing while I'm going through the slideshow as well, but I'm gonna try and keep it open because I want to see some engagement with you all as I'm gonna ask questions throughout and have a chance to see if you guys are doing well. All right, so first off, just a quick reminder, um, we're gonna do this probably at the beginning of every session. If you do not have your full name as your Zoom name, please change that really quickly. Um, so that when we go and do attendance and checking all that stuff later on, that it is correct and we don't have to figure that out later. So really quick, if you don't have your full name, do that quickly. Um, Other than that, let's have a fantastic day. And if you have any issues throughout the session with polls, or issues later, you can message me on Slack after the session and we will figure it out. Cool. Just quickly, um, if you guys want to put in the chat what number you're feeling today, I'm feeling a little bit like a one. I'm waking up, so it's a little early for me, but I'm excited to get the day started. I don't know how you guys are feeling. Awesome. I see some ones, I see some threes, some sixes and fives. Okay, well, I'm
Five,
glad everyone's feeling good.
five.
This is a reminder to make sure you stay muted during all presentations.
Sweet. I'm glad everyone's doing good. If you're tired like me, let's get going. Wakey, wakey, time to go. All right, so today we're going to be learning about emergency first aid and CPRC. Um, CPRC just stands for children as well. So but we're going to be learning for all of it in general. I had the opportunity to volunteer as emergency medicine responder a few summers ago, so I have some experience doing most of these in the field. So I'm happy to answer questions, and hopefully we'll go through it. The one thing I will say is if you have your own experience doing any sort of emergency first aid CPR, you might see things that are slightly different on here than what you learned. This is based on my experience that I learned a few years ago, so it might have been slightly updated. The other thing is, depending on which country and like where you're from, there might be slightly different protocols or different types of equipment that you use when providing these kinds of medical services. So, first off, just a little bit of background, really quick. The difference between CPR and first aid training. So, level C and level A mainly just refer to adults versus children because of the size of the body and the development of the body. There are differences when doing CPR for children and adults, and then BLS stands for basic life support. So if you're doing these trainings, you're doing a CPR training, you want to know which kind of training you're doing when you're signing up for the course, and similar for first aid. So like I said, CPRA, very basics of CPR, learning for adults, defibrillation, and treating emergencies. CPRB stands for babies. So this is the using the anatomy of a child and how to use CPR and a defibrillator for an infant or a child. This is not a substitute. If you need a CPR training, you should have both. But this is a supplement so that we know the difference. And then CPRC covers all aspects of children and adult related um, CPR skills, including rescue skills. And then these are some of the different programs you might end up doing, all involved. So, step one, what are the three C's? The three C's are kind of the first thing you think about when you're doing CPR, and they are check, call, and care. So, the first thing you would do is check the scene, the patient, and the area. So, what is going on? You get all the information you need at the very beginning. And then the second thing you would do is call. So, call 911 if you are not on an ambulance yourself, potentially call for backup if you are on an ambulance or treating, and then provide care for the patient or the person that is in trouble or hurt. So today I'm going to do some examples like you are the a random bystander on the street and you just find someone that's hurt, and some that are, well, I'm on an ambulance. This is what I would do when I'm showing up. So it's going to be a little bit of both. So stick with me. Um, and it should be pretty cool. So arriving at the scene. So if you're arriving at the scene, this is kind of regardless of if you're a bystander or a emergency medical technician or a responder. You want to make sure that there's nothing that can injure you as well. So the typical catchphrase or saying is no fire, no wires, no gas, no glass. So that's these four right here. These are the four things that could cause harm to you or other people, or further harm to the person that's hurt. So you want to make sure that none of these are there. If there are, that's why when you call for emergency services in most countries, the fire department also gets a notification. They get called as well, just to make sure that there isn't fire or gas or wires. I guess glass as well, but glass can kind of be just avoided. Um, and this is something that you want to be careful of because you're no help to someone else if you get hurt. So you want to make sure that it's safe for you, and then you can go and treat whoever's there. If there's gas, leave. This is fire department. They have to deal with it. If many people are lying down, that might be an indicator of gas. Um, and then also same thing if there are other people, if this is like a firefight, like people are shooting at each other or a fight in general, you don't want to get involved and try and get in the middle of it. It's not worth the risk. You want to be safe yourself. So this should happen really quick. It should be a 1, 2, 3 second check. Okay, this is not here. Let's get going. A couple other notes about checking the scene. And when you're checking the area, if you see a knife in your patient's chest, do not remove it. If you see a knife in your patient anywhere, you should probably not remove it. When a knife is in a person, yes, it is causing pain. Yes, it is causing damage. Don't move the knife because it is also keeping all the blood in. Um, the knife is serving as kind of a blockage between any artery or veins that it's cut through, and it's preventing the blood from getting out and leaking out and keeping it in your patient's body. So you do not want to remove it before you have an opportunity to then clamp it in another way. So that is often at the hospital. So they would leave it in and then remove it at the hospital when they can clamp the artery or put a lot of packing in so that it could absorb the blood and stop it. So what you want to do is call 911 if you're not on the ambulance. If you are 911 or whatever the emergency number is in your country, then get them to the hospital. You want to stabilize the wound. So that just means making sure that the knife can't move further, making sure that any damage that is caused right now that you can fix, you fix, and make sure that the patient is conscious. If they're starting to lose consciousness, a good thing to do is start asking them questions, be engaging with them. You want to be able to determine if the patient's consciousness level is changing throughout the ride to the hospital. And then you can check babies first before parents or guardians. Babies need immediate care if it's the same level of severity, because there is less development and less body to offset and keep the whole body going. So the last thing after we've checked the area is to check the patient. Um, there's kind of two main scenarios here, and that's a conscious patient and an unconscious patient. If the patient is unconscious, then it's a lot harder to figure out what happened because you can't talk to them. So it's a little bit different. But first, we're going to start with the conscious patient. So, like we said before, first thing we're going to do, check the scene. Any sharp objects, glass, wire, no fire, no wire, no gas, no glass. Perfect. We're also going to check, no firefight. There's not shots being fired, no one stabbing each other, there's no fighting, and there's also no natural disasters. That's another big one in emergency response. There hasn't been like buildings falling or an earthquake or anything like that. And, that should just take a few seconds. Next thing you want to do is introduce yourself. If you're on the street and you're a civilian, you can just be like, hey, are you okay? I have some emergency response training. Let me help you. How are you feeling? Where does it hurt? Things like that. If you are a first responder or a first aid technician, you'd be like, hey, I'm with the ambulance. This is my name. Where does it hurt? What happened? How are you doing? Um, Big, broad questions like that are good. You want them to give you as much information as possible. If you ask a very specific question, you might not get an answer that is helpful because you're like, if are you stabbed anywhere? No, but that doesn't really tell you if they're hurt anywhere else besides stabbing. So you really want to make sure that you're asking big, broad questions so that they give you as much information in the first few seconds. And then the next thing is you always want to ask for consent if they're able to give it. Um, if they are unconscious, you kind of just proceed as possible or as expected and start giving treatment because you won't be able to ask for consent. In most countries, there's something called the Good Samaritan law, and that is something that protects you as the first responder for giving treatment with someone who is unconscious and can't give consent. If they are like after the fact say they didn't give their consent, but most of the time when they're conscious, you definitely want to ask, do I have consent to give you treatment, especially if you're the civilian. Even when you are the first responder, you want to ask for it, but especially if you're the civilian. And if not, you call 911 for an ambulance. So next steps, if you're the civilian, is you want to start giving whatever CPR or other treatment that you can until the emergency services arrive. Um, this is especially if someone is unconscious and you're doing CPR. When you're arriving at the scene, you help children first, and then you also can help adults after, but you also want to determine who is in the most critical care. If you check the children and they're okay, they just have like minor scrapes and stuff, and then an adult is having trouble breathing and uh starts going to shock or something and stop again and they can't breathe, or their heart stopping, then you definitely want to start doing CPR on them first. So a good thing to do is ask the sample questions. This is just a format for asking questions to kind of gain all the information you need. And This is asking for signs and symptoms. So what are you feeling? What are the symptoms? Allergies, if they have any allergies, you always want to ask to make sure that they don't. Same with medication, you want to know their medications, because this can really affect what kind of symptoms they have. If they have an allergy and their throat is closing, then we probably know what the issue is. Um, then you also want to know past medical history. If someone just went to the hospital for a heart issue, like a stroke or a heart attack, and they're having some chest pain, that's probably an indicator that they might be having another one. So things like that. And then also, last intake is good. You want to know food and water history. If someone is lightheaded and they haven't had any food or water all day, there's probably a reason for that. And then events, what do they remember? So that you can start determining what potentially happened. So now we're going to look at what you do when you get there with an unconscious patient. So, call 911. Like I said, you kind of have implied consent to start doing things and helping them. This is under, like I said, what I mentioned was the Good Samaritan law that most countries have, and that's to protect the person giving treatment under the circumstances that someone wakes up later on and then decides, wow, you didn't have my consent. Um, so it protects you under that. Um, this, the next things you want to do are walk up to the patient, ensure they're laying on their back. Um, this is most of the time just to prevent them from not being able to breathe. So it's open, keeping their airways open. If there's anything blocking, then you could also consider putting them on their side, blocking their airway, that being. And then you want to try and wake them up. Some of the options for waking them up are clapping at their ears really loud, like that, a lot louder though, tapping them on their shoulders, and then you can also pinch the trap muscle, which is on the neck, which is something that hurts quite bad actually, if you pinch hard, and normally that wakes someone up if they're just asleep. Um, you tap the shoulders because it stimulates muscle contractions in their neck and kind of wakes them up. This is kind of the lighter version of the trap pinch, because it doesn't hurt as much and it's not as invasive. But if someone really isn't waking up, you can try the trap pinch, because it normally does the trick unless someone is really, really out of it. So after that, you want to get a bystander to call 911 if you haven't. When you're out in just on the street and you're giving medical attention to anyone, if you are a bystander, you want to turn the other people around you, if you have other people around you, kind of into your team, and take control of the situation. So if you see someone in immediate, I don't know, danger or immediate medical issues, and you see someone bleeding out on the street, or you see someone having a heart attack on the street or something like that, you don't have to take the time to call 911 yourself. You can say, hey, this person, call 911, especially if you see someone already on their phone. And then you can ask someone else to bring a defibrillator if you see someone nearby, and they know what a defibrillator is. Hopefully they do. And nowadays, a lot of public spaces have defibrillators pretty easily accessed in like public bathrooms and things like that. Um, the next thing you want to do is tilt their chin back. What this does is tilting the chin back opens the airway in the neck, so that when you're like this, it closes. So this helps breathe. And then what you can do is you want to check for breathing. So you want to place your ear by their nose, hear if they're breathing, look at their chest, see if it's rising with each breath. And then if they're wearing potentially like a large hoodie or something thick, kind of like what I'm wearing today, you can take that off if it's easy to do, to help look at their chest, because it might be hard with thicker clothing. And then you want to check the ABCs for 5 to 10 seconds, to make sure that they are all clear. So ABCs, I don't know if we covered it yet, or if it's coming up on one of the next slides, but ABCs stands for airways, breathing, and circulation. So this stands for, so the airway was what we did with the neck tilt, the breathing is what we're listening for, and then circulation is checking their pulse. So that's always something good to check right away. So breaking the scenario down into unconscious and breathing, um, if this patient, you checked you put your ear next to their mouth and you check their chest and they're breathing just fine and they're just unconscious and they don't wake up with the trap pinch or the shoulder tap or the clapping. It's pretty simple. If you're the bystander, you're just gonna bend their knee and elbow, kind of like in this image. On either side, this is on the left of a child and like how you're moving them, and then on the right, the end position of an adult, and you gently roll them towards you like the person is doing in this left image. And what this does is it allows the airway to remain open. If there's any food, let's say they're throwing up, then they won't choke on it, because they're not tilted back. And they're able to breathe because they're not tilted forward. And then this knee here also prevents them from rolling around, just through gravity, or like if it's a slanted road or whatever. This will help them stay in position until the ambulance gets there. Um, Another thing that is great to do is continue checking the ABCs as time goes on. You don't want to, check them when you first get there. You call for the ambulance. The ambulance will be there in 10 minutes, and then 5 minutes later, potentially they stop breathing or their airway gets blocked. So you want to continuously check their airway just to make sure that it is still clear while the ambulance is en route. So some of the causes for unconscious and breathing that are quick are things like diabetes, if they haven't eaten or had enough sugar, potentially their sugar is really low, dehydration, weak stomach, which just means like they saw something disturbing and they passed out, or potentially after having a small seizure. So the other thing we're going to look at when unconscious, is unconscious and not breathing. So this is a little more worrisome. Um, Something good to do whenever you're doing CPR, or really whenever um, you're ever on an ambulance or providing treatment in general, is wearing gloves, just because you don't want to get infected with anything or touch anything, as well as for your own safety as well as the patient's, and masks as well. Um, in public, if you're a bystander, you may not have access to them, and that's okay. But ideally, in a perfect scenario, you do. Um, and then these are some of the instructions for doing CPR. So if you go through that whole process we did before with checking the breathing and all that, and you're not getting any breathing, you check their pulse, and you either can't get a pulse or it's really weak. Um, and it's starting to go. If it's really weak, you're gonna want to, monitor it really intensely, because it could stop. And if they're not breathing, then it's probably time to start giving CPR. Um, but if you can't get a pulse, you definitely want to get CPR if they're not breathing. Um, so when you're giving CPR, you want to use your PPE. CPR is a little different for adults and children, but the format is generally similar. You want to have your hands interlocked, kind of like this. Some people have different methods they like. I like this method where I have one hand intertwined in between the fingers of another hand. Some people like to do it just straight up. It's kind of personal preference at that point. You want to have your elbows kind of locked. You don't want to be moving your arms. You want to be moving your chest. So you'll have your hands interlocked to the other over their sternum. The sternum is right here. It's at the kind of a little bit below. It's where the ribs kind of meet here. So you want to have them right here. And what you want to do is you want to do 30 compressions, typically is the standard protocol, followed by 2 rescue breaths. Um, Rescue breaths these days are not actually given mouth to mouth like they are in movies sometimes. They're normally given using a rebreather mask, and I think there's an example of one in the slides a little bit later on. But if not, I can show one at the end potentially. And then in children, you want to go not as deep. So for an adult, you want to go about 5 centimeters deep, or like 2.5 inches, 2.5 to 3 inches. In children, you want to go a little bit less than that, something like about 3 centimeters. It depends on the age of the child. So the general expectation or like guideline is 1/3 chest depth. But that's normally about 3 centimeters. But the protocol is the same, 30 compressions followed by 2 rescue breath. If you're doing it with baby, like a very, very young infant, we use the 2 finger method. So there's kind of two options for that. You could hold your baby or the baby, not necessarily your baby, in your hand here and use 2 fingers like this and push. Um, or what I like to do, the one time that I had to actually do this, is hold the baby in your hand like this and use both your thumbs as your 2 fingers and push like that. So you'd hold the baby with these fingers holding the back and then these thumbs on the sternum pushing like that. Um, and then for babies, it would be uh 100 to 200, 100 to 120 compressions per minute, so about 2 per second. And there isn't really rebreather mask for baby, but there are some out there now. I think this is a newer thing, which is awesome. That there are some rebreather masks for babies. The main issue is getting the mask to fit properly. So I know there are small size rebreather masks, but I think there are also some for babies now that are being used. Okay, so here, these are the equipment that we would use that I was talking about. So things we would use when giving CPR. This is the rebreather mask. When I was doing it, it was called the Ambu pump, which is just the name of the brand, I think. Yeah. Um, but this is the breather mask. You can see where my cursor is on the bottom part there. That is the part that goes over the face. So it wants to go over the nose and then attach around the mouth so that all the oxygen is being pushed in. Um, and then this blue part here is the part you would squeeze, and then this tube part would hook up um, to oxygen or an empty bag if you're just trying to get the airway open. Um, so that's what that would be. This is a defibrillator. This is just an example of one we'll talk about. And then this is an airway. An airway is something you would put in if you're concerned with your patient not breathing. To make sure that the airway is open, you'd force it in, and it kind of goes in the mouth and then turned and then pushed in, um, so that it keeps the airway open and ensures that uh, the air is getting into their lungs. Some of the other equipment you might find on an ambulance when you have a non-breathing patient, is suction. This is normally used if a patient is throwing up, so you can suction all the vomit out, or if there's excess buildup of mucus or saliva in their mouth, you can use this to suck up any of the vomit, or other liquids in the mouth to help with the airway. A catheter, normally you think of catheter like for urine during surgery or for blood. Catheters on the ambulance are normally used to connect to oxygen tanks. So like the end of the catheter would go into the tank, and then the oxygen tanks. So I'm gonna give you guys like 1 minute. If you guys have a pillow or something nearby that you can use, pretend that the pillow is your patient, and you can check the scene, walk up to the patient, see if they're awake, and do all the different steps to check if they need CPR. And then in this case, pretend that they do need CPR, and you can practice your compressions for just a second. So go ahead, you can look at the slide if you need. One sec. There we go. I'm back. You can look at the slide if you need to remember the steps. Remember to keep your arms locked when you're doing it, when you're doing CPR itself. Remember to ask for consent, even though it is a pillow or a couch cushion or just something you have around you. Um, Remember that you want to move your shoulders. You want to move your shoulders down. You don't want to move your elbows or arms in. You want to keep them locked. And you want to keep a consistent 100 to 120 uh, compressions per minute kind of pace. Some people I know when they're working on ambulance have like a metronome app where it just ticks on the the beats or the like the compressions per minute that they want that they play when they're doing CPR. I know some people just sing in their heads like different songs that are at that. Staying Alive, if you guys know Staying Alive is a classic that that most people use. So there's also that. But those are kind of the ways that people get around it. That people do it to keep pace. Okay. I'm gonna let you guys, if you're still doing it, that's cool. Just wrap up in a few seconds and we will get back to the next slides. Cool. So the next scenario we're going to look at is partial versus complete choking. We're going to go through the next few kind of things kind of quickly. So if you have questions after, just let me know. But I want to get to some of the interactives, so we're going to go a little bit faster. So the difference between partial choking is the plugging of the epiglottis. So when someone's partially choking and they feel like they're choking, it's not completely plugged, it's just slightly plugged. The main difference that you can tell between a partial choke and a full choke is someone who is partially choking will be coughing or talking, and someone who is fully choking will not be able to talk at all. So if you see someone and they're telling you like I'm choking, like they're like coughing, tell them to keep coughing. The coughing brings air up through the epiglottis and will potentially dislodge the item itself. Um, and if that doesn't work, then you can also call 911 and do abdominal thrusts if it becomes a complete choking. So, if you need to do abdominal thrusts and it becomes a complete choking, this is when the epiglottis is completely stuck. They only have a few minutes without breathing before they go unconscious, and you want to do an abdominal thrust. Um, these are this on here on the side is kind of an example of someone doing an abdominal thrust. You want to bend the patient slightly forward, put your legs in front of theirs a little bit. They didn't do this, but you want to put them like to the side of theirs. And you want to put your fists wrapped around your thumbs and you want to push up and in underneath their rib cage into their abdomen, and it will kind of push potentially all the air that's in their abdomen up and then dislodge whatever they're choking on. Um, I can't seem to have my chat at this open at this second. I don't know why, but the question we ask is why do we need an abdominal and a chest thrust as well? The reason for chest thrusts is for patients that are in wheelchairs, that are pregnant, that you can't push on their abdomen. The chest thrust is essentially the exact same as the abdominal thrust, it's just higher up on their chest. It doesn't get as much air going, so it's not as effective. But when you have someone who's choking that is pregnant or in a wheelchair, um, it's just the only option you have. So that's just why we use a chest thrust as well. And that's why we have those options. So like I said, these are some of the special cases, wheelchair. Remember to put it in brake, so that they don't go flying around. Use the chest, and then you wrap your arms around the top of the patient, not the sides of the wheelchair. If you have height differences, kneeling can help. Things like this. If you're at a house or an apartment, call 911, open the door. If you're in an apartment, help, ask your neighbor for help, pull the fire alarm if necessary, things like that. Choking in babies slash children. If you have a baby that's choking, you want to place your finger around their chin and keep their mouth open, kind of like this on their mouth. So your fingers would be like that. You want to tilt the baby's face down and give back blows. So how this works is you kind of would have the baby. Let me do this so you guys can see me, so I can see me. So you want to hold the baby face down so that the baby back of the head would be here, and then you'd have your fingers holding the mouth open facing towards the ground. And then you give back blows like this onto their back, decently hard. Um, and what this would do is it would push the air out and then push whatever they're choking out onto the ground. Um, and then you would also give CPR because the baby's body is so small. They don't have as long without oxygen as adults do. So if adults have 2 to 3 minutes, babies have significantly less than that. So you also would start giving CPR, but that's also a dual focus thing because in addition to them not having oxygen having as long without oxygen, doing the finger thrust is also a chest thrust. It's basically the same. So you do like 2 finger thrust as well and you'd flip them over. This technique with the chin and holding the mouth open is called smoking the baby, because it looks like you're smoking. But it's kind of funny, a kind of funny name, but a very serious thing in that it works quite well to get babies to stop choking. And basically you just do this technique of two of 2 finger chest thrusts, and then you go back to smoking the baby again, 5 back blows, back to chest thrusts until whatever they're choking on is dislodged. All right, heart attacks. So heart attacks, also called myocardial infractions, happen because of a blockage to an artery that supplies the heart. This can also lead to a stroke. So strokes and heart attacks are different, but can present with similar symptoms and also similar causes. So something to do when someone has a heart attack is you want to just get them to the hospital basically as fast as possible. Um, if you hear chest pain, especially radiating chest pain, so what radiating means is the pain is kind of going elsewhere. So if you have chest pain plus left arm pain or left shoulder pain is the most common, that is a signifier of a heart attack. Um, and you definitely want to use this knowledge to get them to the hospital as fast as possible. And then if you have a stroke, which is this should say heart attack and stroke, you want to use the fast protocol, which is face arm speech time. So face is, does the face look similar? Can they talk? When you're having a stroke, often one of the symptoms is half of your face will kind of stop working. So if they're talking to you, only half of their lips will work. If they're smiling, only half of their smile will go up. Their arm, if they can raise both arms, then they probably might not be having a stroke. If one arm just drops, there's a good chance that stroke is involved. Speech, slur like with the face, the mouth might not be working properly, so speech can often sound really jumbled or mumbly or not even working at all. And then time, you want to note how long this has been happening for. Bleeding. So quickly through bleeding, if you see superficial wounds, they can just be clear bandage, compressed wound. Just put pressure on it and then a bandage on top, and that's pretty easy to stop bleeding. Pressure stops bleeding. Um, it's really easy to do if it's just superficial and not that deep. If you end up in a situation where someone has a really, really large wound, and you need a tourniquet, you want to do it like this. This is an example of someone drawing blood, so they're obviously not injured, but this is kind of where you want to use a tourniquet. You want to put it above the wound and above the joint. You want to put it above the joint because if you put it on the joint, because of the way joints are, because they bend, they might not stop blood flow properly, so that's not good. And you want to put it above the wound so that there's enough space to have treatment directly on the wound and it doesn't, fall off the tourniquet. So you'd put the tourniquet up here. Let's say if they have, let's say they, have a huge injury near their wrist or their forearm, you'd put the tourniquet up here and you tie it tight, and then that would stop blood flow here so that prevent bleeding out. A few other quick scenarios we're going to go through are allergies. So these are some allergy related symptoms. And then an EpiPen, which is epinephrine, which is also kind of known as adrenaline, is the most common thing that people with allergies or first aid kits have to treat allergies. The EpiPen is not a solution, it is a quote unquote band-aid. Um, and it will just keep that person symptom free or lessen the symptoms until you get them to a hospital. But the EpiPen is very helpful, and a good saying for you when you have to use an EpiPen is blue to the sky, orange to the thigh, so that you know which side goes into the thigh. You generally want to put an EpiPen into the thigh and you want to put it on the upper outside, like medium, middle to outside of the leg, because you don't want to put it directly into the artery, because that could accidentally stop their heart. Because if you have too much adrenaline directly going into the circulatory system, that could stop their heart accidentally. So you put it on the middle outer side of the artery or of the thigh, sorry, and then it will diffuse into the bloodstream itself, and then you just rub that area in to improve the circulation with your hand, and then get that person to a hospital as fast as possible. And then some other quick medical emergencies that are semi-common, um, are nosebleeds. Never tilt the head up, always down. This is really important. Most people think you tilt the head up. That will just cause a blockage and blood dripping down back into your airway and potentially causing you to choke on it. So never do that. Always tell people, you can have a tissue and then just tilt down and let the blood, that is in the nose just go down the sink, or if you are outside. Because generally the amount of blood you lose from a nosebleed is not enough to really cause circulatory issues. So you just want to do that. Knocked out tooth, you can place in milk or saliva until the EMS arrives, and hopefully that you can go to the hospital, go to a dentist, and get it put back in. Chemicals in eyes, use an eye wash system or machine or station is normally the word that I'm looking for. Most labs and places where you would get chemicals use them. If you don't have them at home, go to a sink and splash water in your eye, and then call for an ambulance if needed. Sprains and bone issues is RICE, which is raise, ice, compress, and elevate, I believe. Um, so it's just the way you should um, keep your leg or arm go in place, or the position you should be in for those kinds of injuries. Diabetic emergencies, this is blood sugar, and also just blood sugar emergencies in general. A lot of time the symptoms are pretty aggression focused. If they have either way, if they have too much or too little blood sugar, and then it can also result in fatigue, and then even unconsciousness in some cases. Most ambulances now have some sort of glucose solution, whether that be a gel or a spray or something that they just put under the gums, in the mouth, and that delivers sugar very quickly, so that helps. And then edemas or pulmonary edemas is mucus in the lungs. And then for this is just make patients sit up and get them oxygen to help them breathe and then get them to the hospital. Asthma. Asthma is generally just people don't take their inhaler properly or out of their inhaler. So get them to take it. Make sure they shake the inhaler well. Make sure they're using the inhaler properly as well. I've seen a few people just using it improperly, and that's why it's not working. And then if no progress, 911 and then give more doses. And then cuts/wounds. We kind of talked about using bandages a few minutes ago. But cold tap water for a regular cut or wound. For a heat burn, cool area with 10 minutes. Remove jewelry or clothing around it. Generally, cool tap water is good. Chemical burn, liquid, wash hands, remove clothes. Chemical burn, dry. Do not wash it as it could spread. And then electrical burn, look for an in or out. That would be kind of where the current went in or out, and then go to the hospital for sure. So I don't have my chat open right now, so I'm having a little bit of issues with that. Let's see if I can pull both up so I can see the answers. Let me stop sharing and then reshare, and maybe that'll give it. Okay, where's my chat? There we go. Okay, I got my chat. So we're gonna go through some practice scenarios for today before we wrap up. Um, I see. When I when I full screen it like that, it doesn't like give me my chat. Okay. We'll just do it without the slideshow. Without the slideshow. Fully open. So I'm gonna go through some of these practice scenarios, and then I'll look in the chat and see kind of how people are going. So the first scenario is parent is the background information you guys have is parents calling about their 6-month-old baby saying that the baby's acting strange, and that's all the information you have. So you arrive on the scene. What is the first thing you do? I'm gonna look in chat. Okay. Check the scene, check the scenario, check the area. Yeah, if people wanna unmute at times, just raise your hand if you think you know as well. That's option. But I'm gonna be watching chat, so Davina and Ahmad will be watching the hand raised. Yeah. So I'm seeing lots of check the scene, lots of check the scene. Um, that is definitely the first thing you want to do. Three C's exactly. So um and then after you check the scene, what is the first thing you'd want to do when you are actually talking to, I guess, the parents in this case? Because you can't really talk to a 6-month-old baby, as they're probably not speaking. I'm seeing introduce yourself, ask for consent from the parents, ask the parents what happened, ask sample questions. Yes. So this is all great. Great stuff. You kind of want to do all of this. You want to introduce yourself first. Um, ask parents if you need to actually touch the baby. Then definitely ask for consent. Um, in this scenario, they called the ambulance, so we can kind of assume consent in that scenario. Like they're gonna ask you for help. Ask the parents what happened. So yeah, you want to use sample questions and gather all the information. And then in this case, I wrote down you're working with a partner, so one person would kind of go and talk to the parents, while the other person would check the baby. This is just to be as efficient as possible in case there is a serious issue with the baby. Um, that way you can kind of talk to both. You can kind of do both things at the same time. So from here, they tell you that the baby has no allergies, nothing abnormal has happened recently. The only symptom is the baby is being quiet, but they're making little noises and being kind of squirmish, like rolling around. Um, so what do you think might be happening? Okay, I see seizure, I see choking, I see partial choking.
We have someone with their hand up too, if you want
Oh,
us.
perfect. Yeah. Sama, what do you think might be happening?
Okay, since they are making noises and squishmallow, this means that it's partial. Uh, like they are getting struck, but not too much.
Okay, yep, definitely.
I'll check their blood pressure and see if they're breathing or not.
Okay, perfect. That's definitely potential thing that is happening, and that would be a good course of action to do. So let's look at the next one. So, if in this scenario the partner was checking the baby, not you, and the partner starts getting up and holding the baby with their mouth open with two fingers, what do you guys think the partner just discovered? Even though I think most of you have it now. Um, yeah. So your partner just discovered that the baby is choking, right? So if you figured out the baby was choking, correct? Awesome. Um, and then the baby got access to a small toy and was partially choking, and then the baby started to completely choke. So your partner started smoking the baby and got the toy out. Do you guys remember how to smoke the baby? What the steps are for that? If anyone wants to put it in chat or raise their hand, yeah. Misha, do you want to tell us how to smoke the baby?
Um, Hi, yes. So it's pronounced Maisha.
Oh, sorry, Misha.
That's right. So you would hold the baby face down and you would try, the partner already opened their mouth. So you would like thrust their back few times firmly so that you can get the object out.
Okay. Do you remember what the second part of smoking the baby is? If that's the first part? If not, that's okay, and we can see if someone else remembers. Mariam, do you remember what the second half of smoking the baby is? Okay, I see some people in chat saying it. So, yes,
We
CPR.
should do CPR.
Yes, CPR. So that's the second half. So you do exactly what Maisha said and hold the mouth open, 5 back slaps, and then you swap to CPR and do chest thrusts in the same kind of way that CPR is done. And that would be the whole way to smoke the baby. Okay. We have a few more practice scenarios before we move on and wrap up our workshop. So we'll do these. We'll try and go kind of quick just because we're slightly running out of time. Um, so if you're walking down the street, so in this case, you're not on an ambulance, you're just a bystander, and you see someone on their bike get hit by a car, what is the first thing you do? Okay. I'm seeing a lot of check the area, check the scene, and oh, I saw someone say it. I'm gonna give a shout out if I can find it. Zahar, Zara. Zara said delegate tasks to bystanders. That is exactly what I was looking for. So you want to check the area and you want to call 911 at the same time. So what you would do is you would check the area and you would tell someone nearby, call 911. So awesome. So here you do the 3 C's and call. If the person just got scratched up, they might not need the same level of care as someone more hurt. So either way, especially if someone's not wearing a helmet, they probably should go to the hospital regardless to make sure that there isn't a brain bleed or something like that going on. But you definitely want to delegate tasks to bystanders in this case. If you can see the person, like you can see close enough that you could see their state directly after they got hit, you probably can do the check really quickly and get someone to call 911 very, very quickly. In this case, the person's arm is broken and they have a big gash on one of their arms that is bleeding profusely. Profusely means a lot if you don't, in case English isn't your first language. Um, and but the rest of their body looks okay. What would you do next? Okay. In this case, I'm seeing call 911. So you've already called 911 in this case. I'm seeing tourniquet. I'm seeing rice. I'm seeing tourniquets. Ask for consent. Ask for consent is good. If they're conscious and able to give consent, always good to ask for consent first.
We have a couple people with their hands up too, if you
Oh,
want.
yep, sorry. You can, Davina, do you just want to call first on your screen? Because I don't have
Yeah.
the full camera open, so you can.
Yeah, I have Noor up first.
I'm sorry, I didn't have access to.
Maybe I'll try to stop bleeding by 3 centimeters above the joint and 5 to 6 centimeters above the wound.
Okay, yeah. So that's how you would give a tourniquet. I'm seeing in the chat some other things like if they're not breathing, start CPR. Yep, definitely. Okay. So I agree with the tourniquet. What Noor said. So you'd apply a tourniquet. So in this case, you're a bystander, so you don't have anything. So I saw some people saying makeshift tourniquet. In this case, um, something that works well is kind of sleeves of a shirt. If you can rip the whole sleeve off, that would be something that would work. Um, if you have something else on you, like a bandana or something, maybe that would work. But that's kind of what you want to do. In this case, we didn't go over the types of tourniquets today, but if you're using a makeshift one, there's one called the Russian tourniquet, which is really, really good. And the only things you need for it are some kind of cloth. So um, it would be like part of a shirt and then a pen or a stick or something like that that's strong. And you'd use the pen in the cloth, you'd wrap it around, and then you'd use the pen to kind of twist um, and tighten it. I can send a link to like a YouTube video on Slack of how to do a Russian tourniquet after. Um, Yeah, so I'm seeing lots of people saying kind of like stabilize, check for glass, um, if not breathing, check CPR, check vitals. Yeah, so you want to do all those things if they arise. These are all kind of things that you might see. Um, but in this case, we're kind of saying, oh, you did the check, you didn't find glass, and things like that. So scenario three, I think we have two more, the three and four. So we'll do three and four quickly, and then that'll be the time we have today. And yes, we will send the presentation will be in the Google Drive with all the other information. So you're at the gym and working out, and you see someone in the corner sitting down. They look very sweaty, very pale. Now this could be normal since you're at the gym, but might be some worries about these symptoms? So yeah, dizziness and nausea might be something they're doing, but what is the worry behind it?
I think Miriam has their hands up.
All right, Mariam, what do you think might be some worries about these symptoms?
I should shake their face and their movement, probably maybe heart stroke or something. So
Okay.
if their facial expressions change, they can't control themselves, feel dizzy or can't talk. I must call 911 at this point.
Okay. So yeah, so using the fast method to determine if it's a stroke, that's definitely something you might want to rule out. I'm seeing in the chat heart attack, asthma, blood sugar dehydration. These are all potential options. So that's kind of one of the crazy things about emergency medicine is sometimes a lot of different symptoms can present as different things. So you got to be worried. So if we're talking about the most worrisome things, heart attacks and strokes are definitely up there on the most worried things. Um, so in this case, you go over to him. Again, you're a bystander, you're just working out yourself. He said he feels unwell. He's very sweaty, he's pale, he's weak, he's dizzy. What questions would you want to ask him to help determine the next steps of what this might actually be? Uh, okay, yep, fast. I'm seeing fast in the chat. Fast is good. I'm seeing pain, yes. I'm seeing history, so has this happened before or things like that? Yes. I'm seeing last time he ate or drank water, also great. Um, yeah, so these are all potential things you might wanna ask him. Um, so do you have any chest pain? Can you lift both arms? So that's fast. Chest pain. Um, so in this case, he has no chest pain, but then he smiles and half of his face doesn't go up with the smile. So what do we think this is? I think most of you can probably figure this out at this point. Yeah, I'm seeing tons of stroke in the chat. So yes, definitely stroke. Um, Stroke is the scenario here. What's next is call an ambulance or, like we said, delegate to someone else, and then get him to lay down and stay still just in case it turns into a seizure. And then you want to take vitals if possible and monitor them to get to the hospital. So yeah, that's definitely what we're gonna do. We're running out of time, so we're gonna only do these three today. But like I said, I'm gonna post these slides to the Google Drive, and you guys, there's two more practice scenarios you guys can do on your own. But you guys have been awesome, even like when people have been saying things that didn't like align exactly with the practice scenarios. You guys were saying things that like might be possible. It could have been alternative, like differential diagnoses. So great job, everyone. I saw amazing things in chat. Thank you to everyone who raised their hands and spoke as well. I'm going to hand things back to Ahmad.
Yeah. Well, thank
And
you so much, Rourke, for a great presentation. I wanted to remind everyone that we'll send out all workshop resources, translation resources at the end of the session on Slack, so stay tuned for that. I would now like to transition to our guest speaker portion. Everyone, welcome and joining me, Dr. Damani, who is a pediatric critical care physician at the Cleveland Clinic Children's Hospital. He also serves as a faculty member at Northeast Ohio Medical University and is the CEO and co-founder of High Guru. We thank him for taking his time to join today. I know he has a very busy schedule, so I will now hand over the mic to Dr. Damani.
Awesome. Thank you so much, Ahmad. Just wanted to get everybody's thumbs up if you all can hear me okay. Yep. All right. Wonderful. Wow. I have fireworks behind me because the thumbs up are so good. Lovely. Well, I want to make this very engaging and interactive. We're going to spend some time together over the next 50 minutes or so to not only get to know a little bit about my story, but I would love to get to know you all and your interests. So if you don't mind, if you're at a good spot right now, turning on your camera, if it has been off thus far, that's okay. But if you are in a good spot, just because we're going to make this very engaging, I'd love for us to all have our cameras on throughout this session. Great. And feel free to type in the chat. I know we have so many people on. What I will do is do a formal question and answer towards the end. And Davina, Ahmad, and the whole team will be responding as we go through this. And feel free to even write questions down as you are thinking of them while I'm speaking. All right, great. Well, I want to get a sense from you all. Where are you all logging in from? If you don't mind, just maybe sharing that. That would be great. So we have an international audience, which is so great. Egypt, India, and I know many of you are logging in from various different time zones. So that's excellent as well. Thailand, a lot of Egypt, Canada. Wonderful. Well, this is great. And I am going to share my slides very shortly, but I just want to take a step back and just say thank you for having me. I still remember when Davina was starting some of these MedStem powered sessions, and I had the privilege and honor to speak a few years ago, and I'm glad to be back today. And you all learning in the last hour life-saving skills is kind of the motto of my profession, which I am a ICU doctor. So I take care of very sick children, and having these CPR skills that Rourke went through is very important. So I hope you all took some good notes. Excellent. Very nice. Well, what I'm going to do is I'm going to go ahead and open up my slide deck. If you all can see this slide deck, go ahead and put your thumbs up. It's going to adjust a little bit. Very good. All right. And what I like to do to make it even more interactive is I like to even draw on it. So my hope is that you'll be able to see my drawings as we go through as well. So today's session, I'm going to be focusing on finding your why. Many of you are very young in your education, schooling, career planning. And my hope over these next 45 minutes is to really channel some of the core principles you will need as you progress in a field of STEM. And what I'm going to be doing is sharing a little bit about my story, my work when I work with children. And in particular, I want to share with you something very exciting. What can little children teach us as growing adults inspired or wanting to pursue STEM? So with that, what I'm going to do is I am actually, to start this exercise off, I'm going to share my screen. And many of you all have a smartphone, like a iPhone or Samsung or something like that. And I'd love for you all to open up this QR code. If you are logging in from a desktop computer or like a laptop, feel free. I just put into the main chat a post. And once you are able to get to that either on your phone or on your computer, I'd love for you all to take some time to answer this question. And I see many of you are already on, and I'm going to just flip the screen just for a second to put the code in the corner here so that you all have it.
I think
And
some students are saying that the link doesn't work.
oh, that's interesting. Let me see. Maybe the QR. We're just going to try one more time. Okay, and then copy the link to the board. And I'm going to just put one more link in here. And the question at the top is, and I just put another link in, what interests you in the STEM field? And we're just going to spend a few minutes. It's kind of like an Instagram post, like in the sense that you just have to hit the plus here, and then you can type in your response. Okay. We have a lot of neuroscience. Davina, did this second link work?
Yes, it did. I think everyone's
Okay.
in.
Lovely. Thank you. And as you are typing out your interests, feel free to take a look at the board. And as you look at other people's posts, it would be great for you to even upvote or like maybe a shared interest, something that you also may like. And this can allow for us to see, hey, what is everybody interested in? And it builds a really good community because you're looking at things and you're saying, ooh, this person has the same interest as me. And upvoting that will be great. You can also comment on it as well. Like, I love the brain. And so then you can have that there. All right. We're going to go ahead and spend just a few more moments on this. And I see some people also writing it in the chat box, which is fine as well. And go ahead and take a look, upvote. We have many different interests, some in research, neuroscience, medicine, anatomy, cardiology, helping others. Oh, this is wonderful. Just a few more minutes here. Great. Organic chemistry and biochemistry. Ahmad saying inspiring. Wonderful. Well, this is such a nice segue to what we're going to be talking about, which is kind of the core diagram that is going to help you figure out, maybe you're not in a stage where you know exactly what to do, or you may recognize that things change. We're going to be talking about a very interesting Japanese principle known as ikigai. So by show of hands in the camera, how many of you all have heard of this concept called ikigai? Has anybody heard of ikigai before? All right. So this is a Japanese proverb that basically allows for us to figure out what is the life's balance at the intersection of these curves that I'm going to draw, and I'd encourage you to take notes, there is going to be your life balance. Because as we know, there's something called work-life balance. We can't just always be working, because then we won't have appreciation of life or rest or those meaningful experiences. So what I'm going to be doing right now is I am going to be drawing 3 circles. And feel free to draw these circles with me. And what I am creating, as many of you know, is kind of like a Venn diagram. And pardon my art. All right. Now, these 3 circles are going to represent different whats. And what I mean by that is these are different domains in your life. And in the middle, as we have seen, I'm shading it in black, that is your ikigai. So let's go through this. Many of us have talents. Our family members probably say, hey, you're good at this. So what you're good at is going to be one of the circles. What do you love to do? That's going to be the other circle. The third circle is going to be what the world needs. And then I'm actually going to draw one more circle in this. And this is a circle, kind of like an oval, that says what you can get paid for. Okay. All right. So in between these, there are going to be certain overlaps, and these overlaps will be familiar terms to you. For example, the overlap between what you are good at and what you love to do, this in yellow, that's called your passion. When you're passionate about something, you love to do it, you know you are good at it. Let's say it's like art, music, science. And guess what? You may not be able to get paid for it, or you may not get paid for it, but you still love it because that's your passion. How about this one? What you love to do and what the world needs. So what you love to do and what the world needs, that is called your mission. Because when you combine what you love to do and the gap that, oh my gosh, the world needs another educator, that's your mission. And that is my mission. And you'll hear that in my story. All right. Another overlap. What you're good at and what you can get paid for. That is your profession. Many of us on this wonderful meeting are good at STEM. And eventually that is going to be something that we may get paid for if we are going to go into that profession, or one of the professions that you were writing down on our initial exercise. And then what you can get paid for versus what the world needs. This is a similar term, but this is called your vocation. And you can think of the vocation as your calling. So sometimes our profession and vocation are going to be opposite, right? You may quote, have to do this job because it is financially very stable, or that's the opportunity in your location. But you may have a vocation on the side, like, for example, being a part of a nonprofit or being a social media influencer. That may be your vocation because you really know that the world needs to hear your message and you can potentially get compensated for it. And the center of all this is going to be right here. And that, what did we call it? Your ikigai. And that is going to be the core balance that my hope will allow for you to be happy long term. Your goal is to figure out what are the different themes, domains, hobbies, classes, steps you need to take to find the intersection, which is your ikigai. So for me, I found my ikigai. What I love to do, I love to teach and connect with young minds. What I'm good at, I'm pretty decent at speaking, technology. What I get paid for, I get paid for medicine and what the world needs. I really like to influence how students should learn, be productive, find their inner voice. And that's my vocation. So as you can all see here, your goal is to figure out where is your ikigai. And I hope you can share this with your friends and family, because too often our society does what? It only focuses maybe on this area. Thumbs up if you all agree with that message, that sometimes we just focus on this area and we may not zoom out and look at, hey, what is my passion? What is my mission? What is my vocation, my purpose? Okay. All right. Very good. So with that, I'm going to start with a little bit about my story. My name is Rahul, and I had a unique path into medicine. I did a combined program in the United States called a BSMD program, and it was a 6-year accelerated program. Traditional undergrad is 4 years. I went through school straight from high school, did all the summer classes. I finished my bachelor's in 2 years. And then afterwards, I was admitted into medical school, kind of like a direct track. So from high school, I got a seat in medical school. They said, you need to hit these requirements for the MCAT, which is the entrance exam, as well as the classes during my undergrad. And it was a 2+4 program. So I graduated high school in 2010, and I completed this in 2016. Then from 2016 to 2019, I had to specialize, because once you get your MD, you need to do a specialty. And my specialty I really liked was pediatrics. So I moved to Cleveland, Ohio, which is in the United States. And I started doing my 3 years of residency, and then I could be a board certified pediatrician. How many of you all have gone to see your pediatrician as you were growing up? Do you all remember going to their office, maybe getting those vaccines, talking to your pediatrician? Yep. Great people, right? And what I found is an important calling, and I'll tell you a story about that as well. I found that rather than being in the outpatient office, I liked being in the hospital. That's why I'm wearing my scrubs, because I finished a night shift. And the population within pediatrics, which is children, that I really was drawn to are pediatric ICU patients, the sickest children, children who are unfortunately at the verge of life and death due to some sort of illness or trauma. And so then I went to Atlanta in Georgia, USA, and I did 3 more years of training. So after high school, I did 6 plus 3 plus 3. And finally, I'm starting what we call our attending position, which is a faculty position. You can practice independently on your own. And that's where I'm at right now in Cleveland, Ohio, at Cleveland Clinic Children's Hospital. throughout my journey, one of, you can say, mission, passion, vocation, my ikigai has been education. I absolutely love teaching. I love taking information, consolidating it, and making it simple. This is a picture from 2 weeks ago. I taught a whole seminar on how to use ChatGPT or artificial intelligence in medical education. And so one of the things that I'll encourage you to do is, as you continue to build your STEM passions, and maybe you're in a track like dentistry or pharmacy or some sort of chemistry, find what is the niche within that or around STEM that can also inspire you, that can become your vocation or your mission. What we're going to be focused on for the next 15 minutes or so before the Q&A is, what have children taught me as I have been practicing with children, or, I see children as my patients every single day. And there are 3 important lessons, and I'd encourage you to write them down. But before I go through that, I want to share with you a story that really transformed me. It was March 16th, 2014, and I was home for spring break. I have a younger sister. We're 6 years apart, and she was mere 12 years old at that time. She had a headache, and next thing you know, she was being airlifted to the pediatric ICU. She had a bleed in her brain, and her brain was swelling on the scans. And I still remember, because she was unable to protect her airway and her windpipe, they had to put her on a machine called a ventilator to really help support her breathing. And she was really on the verge of life and death. One morning in the ICU, I remember this scene where on the ventilator, which is going to be showing us how the lungs are working, there was a curve that shows you the lungs are inspiring, exhaling, inspiring, exhaling. And I was in medical school, so I was studying the same picture right here. As you can see, inhale, exhale, inhale, exhale. And it was at that moment that I realized not only that I wanted to serve children in need, just like how the wonderful team helped save my sister's life, but also the fact that knowledge is power. And I want you all to just recognize that as you go through organic chemistry, calculus, algebra, any of these subjects, and you'll be like, why am I studying the phylum of a fish? Remember, every little bit is going to help build that cognitive power. So eventually, whatever STEM field you are going to join, you have the influence of taking that smartness, taking that knowledge, taking those neurons, and actually applying them to serve society. So the first lesson that children have taught me is to always be anti-fragile. Now, how many of you all, by show of hands, have heard the word resilience? How many of you all have heard the word, hey, you have to be resilient? Neha has. Good, exactly. Ahmad has. Yeah, many of you all have heard that word. You have to be very resilient. And I think that that is definitely true. Resilience is defined as going from challenge to challenge to challenge without losing enthusiasm. I'll repeat that definition. Resilience is going from challenge to challenge to challenge without losing enthusiasm. But I'm going to give you a little bit of a spin of resilience, and that's called being anti-fragile. So to illustrate this concept, imagine a burning bush, and that burning bush is going to be in the field, and that burning bush is going to represent your passion, your work ethic. Whenever wind blows on a burning bush, there are 2 ways that you can respond to it. Either the fire goes lower, and as soon as the adversity passes, Then you rise up again, kind of like the phoenix. Now, okay, adversity, the wind is gone. I can burn again. And that's the definition of resilience is, hey, I'm going to get back up as soon as the tragedy is going to leave. But here's what anti-fragile is. Anti-fragile, as I cleared the screen, is when adversity comes, the fuel, which is the adversity, is going to make the fire bigger, bigger, bigger. So what is being anti-fragile? When you have adversity, difficulty, when you maybe got a bad grade, you should not say, oh, I'm going to just kind of stay in the corner and cry and not try again, or maybe I'm going to need some time by myself and then I'll rise up again and do better. Try to be anti-fragile. Use that bad grade, for example, or that rejection letter to really fuel you to work even smarter, even harder. So when adversity comes, always make sure to be anti-fragile and get more fire to work even harder. The quote that is going to drive home this point, difficulty is what wakes up genius. A good sailor, the sailors that we note in history, were never made on very calm waters. They were all made, and that's why we know them, and you study them in history, because they've had what? They've had challenging waters. The more challenge that you get in your life, you should call them opportunities for you to fuel the fire even more. The second important lesson, stay curious. The goal in life is to always have that inner passion to want to not be average, but be the best. Your goal is to always be this child right here. The kid who, even though this toy keeps getting away from it, they are so curious. They are so curious. They're so curious. How many of you all have interacted with the little baby and they just keep wanting to grab something, put it in their mouth? And that's a developmental milestone. Maybe many of you have siblings that have gone through that or are currently in that stage. What are they trying to do? They are trying to express their curiosity as they get to know the world. So the whole point here is that curiosity is the wick in the candle of learning. The more curious you are, the more you shift your attention, and this is a very important point, the more you shift your attention into something we call the locus of your control. Many of us actually bathe in one important thought process. I just want the outcome. When I am teaching students, I teach students for the USMLE board exam, which is the certifying exam. The students always want a good grade, want a good grade, want a good grade. But when you focus on just staying curious, that is something that is going to get you to the good grade. So in order to be happy in a field of STEM, don't focus on the outcome, focus on the process. Because the more you focus on the process, the outcome is going to be there. How many of you all have heard the word frustration? Yeah? Oh, I'm frustrated. Oh my God, I'm so frustrated. And the reason in life why we get frustrated is because our expectations don't meet reality. I wanted to get this grade and I expected to get this grade, but reality told me differently. So in order to be happy, you need to focus on things that are in your control and reduce the expectations. Now, guys, guess what? I'm not saying don't be goal-oriented. But if you have the right actions with the right intentions, then you leave the rest up to faith. Faith in your efforts, faith in a higher power, faith in any element that is going to reduce that expectation. So always work to just show up and be present, but don't always work for a certain outcome or expectation. That expectation will be there if you do deliberate, intentional efforts. What I've really loved in this journey of curiosity is just showing up and keep teaching, 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 teaching. And I'll save the last lesson shortly. But that has ignited such a curiosity in me that if I, as a business person on the side of being a doctor, if I just kept saying, oh, I want to hit this number in sales, this number of students, this number in social media, this number of likes, I would go crazy. So for me, education has been my passion. And for all of you, if you all want to kind of see some more medical content, I'll show you my Instagram here. You can go ahead and give me a follow right now if you'd like. But this entrepreneurial journey has allowed for me to just be so passionate. It's been my vocation, and it's allowed for me to have an outlet for me to be very creative. And I'd encourage you all, that's the number one thing in this day and age, is to have a creative outlet so that then your STEM work can really shine. And the final thing that I will say is learn to be very adaptable. Adaptability is a skill worth mastering. You want to be that person that says yes very early. Here's a quote from the Harvard Business Review. AI won't replace humans, but humans with AI have the potential to replace humans without AI. Read that quote. Humans with AI have the potential to replace humans without AI. Now, everybody must be on this call now. Oh God, do I have to learn everything AI, ChatGPT? Oh my God, do I have to do that? No. The point here is what? Being adaptable allows for you to embrace a new technology, see if it fits in your value system, and then gauge how is it going to fit into your life. But the more that you start being an early adopter, the more that you can say, I'm adaptable. Oh, yeah, if there's a change in this school, yeah, don't worry. I'm not going to be that group that's just going to be frustrated all the time and mad. Okay, I'll just pivot and adapt. And that loops back to the second principle, reduce your expectation. So being adaptable and innovating very early or taking on an innovation very early is actually a really good skill set. As we noted today, everything is a balance. School, personal, career. And your goal is to always figure out how are you going to strike that balance and from a philosophical level, find your ikigai. So just as some retention, I would absolutely love if you all could type in one lesson that resonated with you out of the three. Let's see if you all can remember one lesson out of the three. Go ahead and type that into the chat box. All right. Excellent. Many of you all have a great memory and high engagement and attention. Yeah. Stay curious. Be adaptable. Be anti-fragile, right? Those were the three key lessons. And as you can see here, the road to success and finding your ikigai is going to have ups and downs. But the more that you can be anti-fragile, using adversity to fuel you, the more that you can stay curious, reducing the expectations. And number three, the more you can say yes to adapt very early on. I know that you all will be of great success in this field and beyond. And so with that, I'd love to spend the remaining amount of time with some question and answer. feel free to actually put your question either in the chat box, or if you feel comfortable, raise your hand. Davina, what we'll do is we will actually alternate. So we'll take somebody who may want to do it from the microphone and then one in the chat box. And maybe Davina, you can look at the chat box and then mention any of the questions as we get to it. So feel free to run the Q&A. I'm going to end real quick before the Q&A by showing you an awesome picture. This is my wife and I, and we ended up, because she was doing her medical training and residency, she's also a doctor. We were apart for 6 years, and we were married for 3 years and just living apart. And I would be flying, she would be flying. And finally, we started living together in this last year, and it's been so, so fun. But I just wanted to share this one little sacrifice that we had to go through, a little bit of a bump in a road. And now she is an OBGYN. So she does women's health and delivers babies and does surgery. And I'm in the pediatric ICU, and we're all in one city finally. So that's been exciting. But these are the stages of life. And I know many of you all will go through this in due time, but just wanted to share that small story as we close. All right.
Awesome. Thank you so much. I'm already seeing a flood of questions in the chat, and we have people with their hands up. So I think what we can do is call on one person that has their hand up and then do a question from the chat and alternate until you have to go. So I think the first person that has their hand up is Basil or Bazel.
Hi, I have a question. What advice would you give to a future scientist who dream to become a scientist one day, but feels the journey is too challenging or out of reach?
I would say one major advice piece would be to create your network early. It's so important for you to get as many mentors as possible, and then figure out what are the different themes all of those mentors are saying. Those themes may be, hey, this is the new field that you should go towards. But your goal, as you embrace the 3 principles we talked about, is get the mentorship, build the network, and really nurture that bond. You don't need many mentors, you just need a few. But a student who comes to me that says, Dr. Demania, we haven't talked for a few weeks. I'd love to schedule a meeting, just 30 minutes. This is what I've been thinking. What do you think in science? How can I help you in your projects? Always being dependable as you grow your mentorship network is going to be so important.
Awesome. Thank you so much. Our next question is from the chat, and someone asks, what are some of the main diseases that you see in children?
That's great. Many of the diseases that we see in children are going to be respiratory infections, just because children do get viral and bacterial infections like the common cold, but because their airways are so small, at times the children can have some difficulty with breathing, and we have to treat that. Other things we see are seizures. So many times children may have some genetic disorders that happened at birth, and we have to manage those, whether it's seizures or some other deformity of the body. And then finally, at times, unfortunately, we see babies accidentally getting into some substances, or teenagers who may have mental health issues that are taking substances that are life-threatening. So these are all some of the scenarios, but the world of pediatric ICU is very, very broad. It just focuses a lot on the sickest children in the hospital or in the community.
Awesome. Thank you. Our next question is from Maisha, and I think they have their hand raised.
Yes, thank you. First of all, I just wanted to say thank you, Doctor, for the great presentation. I really liked how interactive it was. What I wanted to ask, and I've always wanted to ask this to someone who's working in the pediatrics field, is how you navigate telling children bad news. I think that's the toughest part of the job. And to be honest, even thinking of it just, makes me kind of scared or hesitant about that. And subsequently to that, what are some, communication mistakes that you see happen often when you're communicating with children or their parents about some particularly negative news?
Yeah. I think that, Maisha, your question is great because it actually alludes to the fact that medicine is actually an art, not necessarily a hardcore science sometimes. One thing, and I say this to any family whose children come to the ICU, which is a really scary thing. I mean, imagine the most innocent member of your family is now extremely sick, maybe knocking on death's door. And what I first say is, I'm not just here to treat your child, but I'm here to treat the whole family. And so the biggest thing that I do when I am delivering bad news is I'm making sure that the whole support system is there. And I am not just having one conversation. That's one of the pitfalls that I see is one conversation only. But at times, in order to get through bad news or to communicate grief or bad news, you have to be very understanding that that's going to come in snapshots. Because if I say the word cancer and then I just go on about the science of cancer and all this kind of stuff, sometimes the families just won't process that as well. And so as a result, you have to be very willing to A, communicate to the developmental stage and language of the child, but also B, have repeated conversations and take that time and be intentional about it.
Thank you so much, doctor. I think that's going to really help me. I have seen some of my classmates. In fact, one of my classmates right now is going through a really, really tough time with cancer. And, reaching out to them, it gets kind of tough to talk to them. And I think this advice is going to really, really help me talk to them and help them through their journey. Thank you so much.
Yeah, great question.
Awesome. So our next question is from the chat, and this person is a rising junior in high school, and they've heard about BSMD programs, but they want to know what you did in high school to show that you were really passionate about medicine, and how do you stand out? Just general tips and advice on extracurriculars and stuff like that.
Yeah, no, that's great. For me, I found great value in making sure I did well, not only academically. So, for example, in my GPA in school, taking the more challenging classes in high school, also making sure that my TSAT, SAT, or ACT scores, those achievement tests were very high. I was very deliberate about that. For extracurriculars, I only chose one or two. It was one club and then one sport, and I became really, really good. I was actually in the top 16 in the state of Ohio in tennis, and I was just a very big tennis player. And then, similar to the answer to my first question, I built only two or three really strong mentors, but I would make sure I would shadow them. I would utilize their insight to kind of befriend them. And one opportunity led to the other because as soon as they maybe saw a volunteer program, they would give it to me or they would say, "Hey, are you interested in this?" And that's only because I built a bond that involved a lot of communication and a lot of respect towards them. So these are some of the advice points. And I would do the BSMD program again if I could, because it was a great experience. It also saves years. It saves sometimes hassle in terms of applying after undergrad. So it is something that if you're really resolved to go into medicine, you should consider very early on in your high school journey.
Thank you so much. Our next question is from someone that has their hand raised. So we have Julie. Okay, we'll move on to the next person that has their hand raised, which is Ruwaida.
Hey, hi. Firstly, I'm so happy that I heard from you. It was so useful and I had so many information. And my question would be, how can you give me an advice or give me a name of extracurricular activity and how can I make my network bigger and how I can connect with more people to help me in my STEM field and my STEM journey?
Yeah, that's a great point. I would say that you could do things locally. So I love starting at the library or any religious facility. Those are great areas for you to start locally. You can also, if you're interested, go to any research institute, university, or a hospital and see what are the opportunities there. Finally, I would say being present on social media in a professional capacity, for example, LinkedIn, is a really good idea. And even if you are not wanting to go into LinkedIn just yet, keeping a CV or a list of experiences very organized is going to help you as you build the network. Because here's one of the things that I do practically. Let's say I'm going to be meeting another doctor. I have a one-page kind of summary of who I am that I print out and I give to them. And that really helps them frame the discussion much better. It has my photo and it's just a one page. What am I interested in?
Thank you.
Okay, awesome. So our next question is from the chat, and a couple of people have asked, what are some of the biggest challenges or difficulties that you've faced during your line of work and how to make sure that you pick the right field?
Yeah, I think I'll answer the first question in particular. One of the greatest challenges for me was trying to build my entrepreneurial medical education business, which is High Guru, and still be a really good trainee, a resident, a medical student, a fellow, which is a subspecialty. I was really challenged because any small time that I would have, rather than focus on relaxation and enjoyment, I was working on my passion, which is my business and growing that. And I think that that definitely has paid some great rewards, not only financially, but otherwise, impact wise. But that was really challenging for me in the last 10 years or so, because sometimes my health would be compromised. Rather than taking that extra walk or going to the gym, I would have a rationalization in my mind that, oh, I have to just keep working, working, working. And I think that the truth is in the middle. And I would encourage everybody, as you all get more busy with opportunities, to find a really good balance. We'll take three more.
Yeah, that sounds great. So our next question is from someone who has their hand raised, Judy.
Yes. First of all, you and your wife are very cute together.
Thank you.
My query is, what will your advice be for someone who always feel like they did the wrong choice in life?
That's a really good question. I would say that it may loop back to that second point, and that is to maybe reduce the expectations that you may have. One of the things that I will say is the more that you stay curious and the more that you just focus on, let's say, the process of learning, a decision won't necessarily be categorized as right or wrong. Now, let's say, for example, you are feeling a little bit low and you feel like you're not making the best decisions. This is a very important point. I always say that meaning in life is generated from contrasting experiences and recognizing that some days are going to be bad and some moments in life are going to be bad and some moments are going to be good is a very important skill for you to internalize, or a mindset. The best example that I can give is, imagine you had a family member that you haven't seen for quite some time. You're so excited to pick them up from the airport. Why are you so excited? You're so excited because you've had the pain of telling somebody at the airport goodbye. And that's why you have so much excitement for somebody who comes, because you know what hard goodbyes are. So that's why when you feel like you're making the wrong decisions, it may be the turning point for you to appreciate something good that may happen shortly.
Okay, thank you so much.
Our next question is something that a couple of people have asked in the chat. So how do you differentiate between, something that you're passionate in versus a career, and how do you balance that?
It's a great question. I think that a lens of practicality needs to be there, and practicality that involves not only your sentiments, but maybe your family's sentiments. And what I would tell you is not only to be practical, sometimes that is a more traditional path, but recognize that that path is not necessarily fixed. And in this day and age, when opportunities are plentiful, you may want to transition into a mindset of, hey, this may be a profession for right now, but it's not necessarily my passion. I'm going to stay curious and just learn and be the best. And then I have the opportunity in a different season of my life to get closer and closer to my passion. And we'll do one more.
Awesome. Okay, so we'll take a question from someone that has their hand raised. So Judy, and then last name starts with an E.
Hello.
If
Hi.
she doesn't reply, may I ask some questions?
She did reply.
Oh, okay. Sorry for that.
No worries.
Okay, and my question, first, thank you for this amazing session. And also, I have a question about the biomedical engineering. Do you think the biomedical engineering can treat some diseases or can help to reduce the pain of the children?
Excellent question. Biomedical engineering is a great field because I think it combines technology and medicine, and it allows for you to be very close to the frontline providers like physicians, nurse practitioners, etc. And I definitely think that there is some element of innovation that can help not only pediatrics, but health in general. So I like the field of biomedical engineering. Excellent.
Do you think that this job will have a great state in the future?
I think so.
Okay, thank you.
Absolutely.
Okay.
Davina, this was wonderful. Thank you so much. Feel free to connect with me on Instagram. And I know many of you have lingering questions, so I'll try to get back to you if you message me on Instagram and we can go from there. Davina, shall we do a group photo together?
Sure, yeah, we can definitely do a group photo. So if everyone wants to turn their cameras on, feel free. We'll take a group photo and then we'll send this to you as well. We are asking participants to put some of their questions in a Google form too, so it's more organized. We can also just send that to you in one link, so it's all in one place.
Perfect. That's great.
Yeah, and then after the group photo, we'll do a little round of applause for you as well.
Oh, thank you.
Of course. Okay. I'm going to give everyone 1 minute to turn their cameras on just because we want to be respectful of Dr. Dominia's time. And then please lower your hands. If you have your hands raised, please make sure you lower them so that they don't end up in the final picture. Okay, I'm going to give everyone 30 more seconds and then we should be good. But yes, just a reminder, if you have any questions for Dr. Domania, I know that a lot of you didn't get to ask questions today just because there are so many awesome questions and so many awesome participants. You will be able to ask them after the session. It's part of the attendance form that I sent out, and you can also connect with him on Instagram. Please be respectful when messaging Dr. Domania on Instagram, so don't spam him or anything. Just send one question and then wait to see if he responds. Okay, I'm gonna have to take a couple of pictures just because not everyone fits on my first screen. So I'll give everyone a little countdown and then I'll take a few pictures and then keep smiling because I'll have to take a few. All right, everyone ready to go? I'll give everyone a countdown from 3. And then please don't message in the chat while I'm doing this because if you message in the chat, you're gonna be covering someone's face. Okay, 3, 2, 1. And then keep smiling. I got a couple more to take. Okay, 3, 2, 1. Okay, perfect. I've got everything. Thank you so much, everyone, for coming out today. Let's do a little Zoom round of applause for Dr. Domania. You can hit the react button on your Zoom chat just to thank him for taking so much time to speak to us today after he worked a night shift. Hopefully you learned something from him. You can follow him on social media. He actually posts a lot of really great responses to USMLE prompts and just advice about how to to really get your foot in the field and how to approach these difficult kinds of questions. So thank you so much again to Dr. Domenia. We really, really appreciate you being here, and he's spoken at our previous programs as well. He's a fantastic speaker. So we wish you the best. And yes, everyone was saying in the chat that you and your wife are very cute.
Oh, thank you. I appreciate it. I'll let her know too. So enjoy the rest of the program. Take care, everybody. Thank you.
Thank you so much.
Bye.
Amazing. Okay, so I sent out the attendance form in the chat. I'm going to pause the chat so that people can see the attendance form. This is the only form that you need to do for the session.